Well, last week I invited you to submit some questions on the health care reform debate that's going on here in Washington. Democrats are completely committed to reform. The present system is not only unacceptable, it's unsustainable. Given the rising percentage of our gross domestic product, the number of people without any coverage at all, for those who have it, the premiums are outstripping their ability to pay. This is clearly an issue that demands our attention, and we intend to do everything we can in the coming weeks to enact meaningful health care reform in the country. So thank you for submitting so many ideas and thoughts, as many of you did. I want to share with you two or three of the questions I received that I thought were pretty good and get to the heart of the issue. And while we haven't resolved the matters yet, I thought it would give you some idea of the direction we're trying to take our committee in. First of all, I got a great question from Rachel in Boston. And she writes, as long as for-profit insurance companies are involved in making health care decisions, health care will be compromised. We cannot have non-medical people making medical decisions based on money. Couldn't agree with you more. Senator Kennedy has been the chair of our committee and worked so hard for 4 decades on these issues. Clearly, we want a system whereby people have choices. If you like what you've got, you ought to be able to keep it. I mean, we're not going to try and change everybody's health care system. We want to make sure that we're dealing with cost. The rising cost is unsustainable. As I said, our economy cannot sustain it. People's personal incomes can. And obviously coverage and quality, not just a quantity-based system, but a value-based system, a quality-based system. And that's what we're trying to put together. Market reforms. No matter what your condition may be, that can no longer be a consideration as to whether or not you're going to get coverage at all. If you move around in the country, the portability, that no longer is an issue. No matter where you reside, no matter what your health condition, those can no longer be conditions. And dealing with age, we want to reduce that disparity. It's wide disparity in parts of the country. So pre-existing conditions, portability, the issue of age, all of these matters ought not to bar you from getting the kind of coverage you deserve. So I thank Rachel for her question. We also had a very good question from IWY back in my state of Hartford, Connecticut. And he suggests separate employers from employees for managing, paying, and determining their health care plan. Medical costs should be posted on a neutral website. Absolutely. One of the things we Democrats are advocating in our reform package is creating gateways where people would actually come and shop. Many of us would like to see a public option included as part of those options, where people can actually make choices about what they think would suit them best in that neutral site without the kind of marketing techniques that drive people in one direction or another. So we're determined to create these gateways for people where they can buy affordable coverage for themselves, have choices to make those decisions for their particular needs or their family needs as well. So it's a very good suggestion. B.R. Ambrose of Charlotte, North Carolina writes in this question, health is health. Don't treat eyes or teeth differently from arms and legs. Amen. Obviously, we've seen in the past that the health care needs of people can be widely disparate. One of the things we did last year, which was long overdue, was to treat mental health illnesses along with physical illnesses on an equal footing, called the Mental Health Parity Bill. That was a major breakthrough in health care coverage, starting to treat those kind of problems on the equal footing. And certainly the other problems people face ought not to be discriminated against when it comes to people's health care needs. And also in the age area. An area of particular interest to me is children. Many of our health care plans don't take into account how children are different. They're not just smaller sizes of adults. Their physiology is different, their needs are different, and we ought to be accommodating their health care needs differently than those of adults. Just one example of what we're trying to deal with. But again, it comes down to these issues. Making sure there's choice, making sure we reduce cost, making sure that prevention and quality are going to be major features of the Democratic proposals on health care reform. This is very, very important. If you want to hear more about this and you have more ideas you'd like to submit as this process goes forward, at the Senate Hub or my own personal Senate website are ways in which you can be in touch with us and share with us your thoughts and ideas. Thanks for paying attention.